Hi family, welcome to Derben Live, your usual host Benedict. Today we are looking at something very popular. Today we are looking at arthritis. I think in Chi they call it sasabro. Yeah, so what is arthritis? It's a term given to a numerous number of issues affecting the joints and surrounding tissues. The most common type of arthritis include rheumatoid arthritis, osteoarthritis, psoriatic arthritis, gout. Gout is very, very popular. You hear of that more. And the last one is lupus. So now let's look at them individually. The five we've mentioned. We're looking at osteoarthritis. This this occurs when there is wear and tear on the joint, causing cartilage and then bone on bone contact. So this is also common, and most people, I mean, the aged have this one. And then let's look at the rheumatoid arthritis. It's an autoimmune disease. Autoimmune means it occurs as a result of a defect. Yes. Autoimmune disease causing inflammation and joint pain. In rheumatoid arthritis, there is inflammation and there is severe joint pain. And psoriatic arthritis is the type which consists of both psoriasis and arthritis. So there are two different conditions combined together. And the gout. Gout comes as a result of uric acid buildup between the joints. Gout occurs as a result of uric acid buildup within the joints. And this is very, very painful and also common. And then the last one is lupus. Lupus is also an autoimmune disease that can affect multiple body systems, including the joint. Now let's look at some causes and then risk factors of arthritis. You have genetics. Sometimes it's in the family and it's included in your. It comes with your generation. We have age. Age also poses a risk factor. The more you grow, the more you are susceptible to arthritis. Obesity. That's excess weight can also cause additional stress on your joint, as we all know, especially the ladies with the big, you know, the ladies that are big at the necessary areas, they mostly have knee joint pain, and that can also cause arthritis. Then we have injury or trauma. Joint injuries can also increase the risk of arthritis over time. Then we have infection. Certain infection, when left untreated or when left not treated well, can lead to or trigger arthritis. Now let's look at some symptoms of arthritis. The, mo- the most common symptom of arthritis is joint pain and then stiffness. We have swelling and redness. We have limited mobility. Of course, when you have joint pain, you wouldn't move as much as you are supposed to. And we have fatigue. Chronic pain and inflammation can also lead to fatigue. Now let's look at how arthritis is diagnosed. You diagnose arthritis through medical examination or medical history. You can diagnose it through physical examination. You can use imaging tests such as X-rays, CT scan, and then MRI. Blood test can also be used, especially when it comes to checking the uric acid level. Yes, and the uric acid, as I said earlier, is linked to gout. Then we have the treatment options. We have medications, mostly pain relievers, anti-inflammatory medications, and then disease modifying anti-rheumatic drugs. We have lifestyle changes. We have physical therapy, that's physiotherapy. And we have surgery in the worst case. Let's look at some complications of arthritis as well. We have disability, total disability. That's when you become immobile, when you cannot move anymore. And then we also have comorbidities. Arthritis can increase the risk of other diseases such as cardiovascular diseases. We have mental health. Chronic pain and inflammation can lead to mental health issues such as depression as well as anxiety. Let's look at the management and prevention of this. Early diagnosis is always a better option to treatment when it comes to diseases. We have lifestyle changes, we have stress management, we have regular checkups. Arthritis is something very, very common, but it's mostly based on our lifestyle and especially our diet. It could be genetic as well, but Even if it's genetic, our lifestyle can handle this situation very, very well. I hope this information on arthritis would go a long way to help us all. Thanks for being with us today too. See you next time.